There are new mandatory procedures in place in WA public hospitals for measuring and recording supplies of liquid medicines. The following training video has been developed to show you what you need to do to fulfil your responsibilities when supplying liquid medicines. Once you have watched the video, you can join the conversation on loss prevention by clicking on the survey link on the web page. When S8 and S4R medicine supplies are received, they should be in their original bottle. Methadone syrup for the treatment of opioid dependence is an exception. This must be prepared by the pharmacy department and supplied in unit doses for the patient. Only one bottle of each drug and strength should be in use at any one time. Bungs and oral dosing syringes must be used to measure oral liquid medicine doses unless your hospital has a written policy that allows the use of a different method, such as a calibrated bottle top dispenser. Bungs must be available in all clinical areas handling liquid medicines. Fit the bung after opening the bottle. This must remain in the same bottle for the entire time the bottle is in use. Before you issue the first dose from a bottle, make sure you record the level of medicine, either by using the scale on the label or by marking up tape or stickers that have been fitted to the side. Tape must be placed on the edge of the original bottle label, being careful not to obscure information such as drug name, strength, expiry or batch number. To measure a dose from a bottle with a bung, use a new oral dosing syringe to measure every patient's dose. Don't pour directly from the bottle and don't use IV syringes. When you have withdrawn the dose, mark the remaining volume of liquid and the date on the scale. Each S8 or S4R dose must be entered into the correct page in the relevant register. Details which must be documented include the patient name, unit record number, doctor prescribing the medicine, dose and time of administration. It's important that the prescription, administration and documentation is observed and checked by a second person, a registered nurse, pharmacist or doctor, depending on your hospital policy. Balances checks must be performed at least once daily in accordance with hospital policy. Registers and drug levels must be checked at the time of transfer between the pharmacy department and the ward. To conduct a balance check, you visually inspect the bottle, checking that the volume of medicine matches the marked up scale. You must not decant the liquid when performing a balance check. It's a visual check only. Compare the visual volume to the balance recorded in the register. After each balance check, make an entry on a separate line in the register. If a discrepancy is suspected, contact pharmacy who will assist in performing a stock reconciliation. When you withdraw the last dose from a bottle, you must perform a stock reconciliation. The reconciliation ensures that the register correctly reflects the actual amount of liquid on hand. Enter the information about the final dose to be administered from the bottle in the register and what the balance should be after this dose. The stock reconciliation is entered on a separate line. Check the balance of stock on hand and enter in the register. Work out if there is an excess or shortage by taking the register balance away from the balance of stock on hand. In this case, there should have been enough in the bottle to draw the last 10 millilitres, but there's 3 millilitres less than there should be. You follow the same process if there's an excess in the bottle. In this example, using hydromorphone, there shouldn't be enough stock in the current bottle to issue the whole dose. The register balance should be 471 millilitres after the dose, but the stock balance is 473 millilitres. There's an excess of 2 millilitres. 2 authorised staff must sign the reconciliation. Authorised staff may be a nurse, pharmacist or a doctor depending on your hospital policy. Don't forget to follow up and report discrepancies. At the end of the bottle, write up the stock reconciliation and document the discrepancy. Go back through the register and count the number of doses since the previous stock reconciliation. To calculate the discrepancy per dose, divide the discrepancy volume by the number of doses since the last reconciliation. Record the discrepancy per dose as part of the most recent stock reconciliation. 2 authorised staff must sign the reconciliation. If the discrepancy per dose is 0.2 millilitres or less, no report is required. In this example, when the discrepancy volume is divided by the number of doses since the last stock reconciliation, we see that the discrepancy is more than 0.2 millilitres per dose. You must follow up and report on all discrepancies more than 0.2 millilitres per dose. If the discrepancy is more than 0.2 millilitres per dose, follow up on the discrepancy and submit a report to the Corporate Governance Directorate within 24 hours. Reporting helps to improve measurement practice and to identify possible theft. You should also report any concern about the quality or integrity of an S8 or S4R oral liquid medicine. Now that you're the full bottle on liquid medicines, we would love your feedback on this project. Click the survey link on the web page below. 3 quick questions is all it takes. For further information, you can talk with your Medication Incident Coordinator, read the Operational Directive, or visit the Health Department website, health.wa.gov.au, and search pharmacy.